Dimethyl sulfoxide is an anti-inflammatory and may be applied topically to reduce pain and swelling. DMSO has a long history as a topical anti-inflammatory agent. It's extracted as a byproduct of paper making, and it's also naturally found in garlic. In different countries, DMSO is a prescription medicine or a dietary supplement. It can be taken by mouth, applied to the skin, used topically, or injected into the veins, used intravenously or by an IV. DMSO is taken by mouth, used topically, or given intravenously for the management of amyloidosis and related symptoms. In other countries, it can only be purchased for use as a muscle rub for horses. DMSO is an organosulfur compound. This colourless liquid is an important polar aprotic solvent, and it dissolves both polar and non-polar compounds, and is miscible in a wide range of organic solvents as well as water. It also has a relatively high boiling point. Some use it to make solutions out of all sorts of chemicals such as CBD, melatonin, nootropics like Noopept, SARMs and other research chemicals. One experimental solution is a mix of DMSO and melatonin for melatonin enhancement and pineal gland detoxification. It's also been used to dissolve herbal and alternative anti-cancer solutions and then applied directly to the site of the cancer to enhance delivery to the desired area. Some have even mixed it with amino acids and applied it to animals' eyes in an attempt to remove cataracts. Again, this is just information about experiments that have been carried out, and it's not medical advice or an endorsement to try any unproven therapy without the supervision of your medical doctor. DMSO alone has analgesic properties. Research shows that DMSO slows or blocks the conduction of impulses along nerve cells, which in effect reduces pain from musculoskeletal injuries, postoperative incisions, and other sources. It's rapidly absorbed when applied to the skin, and it's been shown to reduce pain and inflammation. DMSO is used as a prescription drug to treat inflammation and pain of the bladder. DMSO is readily absorbed by animals and humans by dermal and oral routes, and it enhances the absorption of many other chemicals by these routes. Higher concentrations of DMSO are more readily absorbed than more dilute solutions of the DMSO in water. It's for this reason that many biohackers use DMSO to dissolve their research chemicals when making an oral solution in order to take their substance of choice under the tongue, which is known as sublingually, in the attempt to increase the absorption and the effectiveness of the product. As different drugs get absorbed at different rates in the digestive tract, their aim is to reach near 100% absorption through the oral sublingual route. One interesting experiment is with xylitol. The sweetener is dissolved in DMSO and then applied to the foot. The sweet taste is noticed in your mouth, proving the powerful transdermal route of administration. Many would prefer to topically apply a DMSO solution to their skin instead of injecting a substance to improve its absorption. It should be noted that as the transdermal route is so effective, the skin should be cleaned first before use, otherwise the DMSO risks pulling undesirable dirt and toxins that may be on your skin into your body. Topically, it's applied 3 to 4 times a day, but DMSO sold without a prescription can range from 10% concentration to 90%. People have also used it to try to treat such conditions as headache, rheumatoid arthritis, eye problems, scars, and scleroderma. Early research suggests that applying DMSO to the skin might help the skin heal after surgery. Early research also suggests that applying a DMSO 10% gel to the skin might improve pain and joint movement in people with tendon injuries. Small studies suggest that DMSO can help to relieve peripheral neuropathy and post-thoracotomy pain. Some of the proven benefits of DMSO. It has antimicrobial properties. It's a muscle relaxant. It increases production of white cells and macrophages, which are important cells for the immune system. It increases cell membrane permeability, allowing for removal of toxins. It's radioprotective, reducing the mutagenic and lethal effects of X-rays. It inhibits cholinesterase enzyme from breaking down acetylcholine, an important neurotransmitter. It's an excellent heavy metal detoxifier, binding to aluminium, mercury, cadmium, arsenic and nickel, and eliminating them through urination and sweat. It's an effective painkiller, blocking nerve, conducting pain signals, and it exhibits cryoprotective properties. It helps to preserve stem cells, bone marrow cells and organs, protecting them against injury from freezing during organ transportation, and it protects against damage during interstitial cystitis and cancer radiation therapy. These are both FDA-approved uses. It's bacteriostatic, meaning that it inhibits the growth of bacteria. It acts as a diuretic. It reduces inflammation and swelling by affecting inflammatory chemicals. It improves blood supply to injured areas by dilating blood vessels, and it reduces blood viscosity, increasing the delivery of oxygen to the cells. It's a potent free radical scavenger, transporting these substances through excretory organs, and it's transdermal, easily penetrating the skin and the blood-brain barrier, and it enters the bloodstream. It protects the cells from mechanical damage more rapidly than pharmaceutical drugs. It has calming effects on the central nervous system. It acts as a carrier for all other drugs and supplements, and it increases their effects. For example, chemotherapy, corticosteroids, antibiotics, and insulin show less undesirable effects and can be used in much smaller quantities. It has anti-nociceptive properties, meaning that it reduces the sensitivity to any dangerous or harmful stimuli. Once the DMSO is absorbed by your body, it's metabolized or broken down by the body, and the products of this metabolic breakdown still have sulfur in them, and because these smaller molecules are arranged differently, they can have a garlic-like taste and smell. DMSO is usually well tolerated with no observable toxic effects to a cell at a 0.1% final concentration. At 1% or higher, toxic effects have been reported. The response will depend on the type of cell or the cell line. In 1965, however, the FDA banned all clinical trials involving DMSO because it was found to cause changes in the refractive index of the lens of the eyes of a number of animals, mainly rabbits. The suggested mechanism for DMSO cytotoxicity is the effect on the physical property of the phospholipid membrane. As an amphipathic solvent, DMSO can interact with the plasma membrane, allowing pore formation, which contributes to a decreased membrane selectivity and an increased cell permeability. However, this is debatable, as increasing cell permeability may have some benefits, and in the lab, as DMSO is a polar aprotic organic solvent, it's commonly used as a cryoprotectant because of its membrane penetrating and water displacement properties. It's added to cell culture media to reduce ice formation and thereby prevent cell death during the freezing process. Also, after the scare with animals' eyes, a human trial was conducted on 200 prisoners who were given 60 milliliters of DMSO per day. They received regular eye exams, brain, heart, liver and other tests, and the only side effects that were noted were the temporary garlic smell and some dry, cracked skin where the DMSO was topically applied. The dry, cracked skin was remedied by adding aloe vera gel to the DMSO. Whatever your take on DMSO, it's worth reading the many books on its healing properties and learning about the exaggerated and sometimes unfounded side effects that are suggested about it. And like most medicinal substances, it's up to you and your doctor to weigh the risks against the potential profound benefits that this may have for you.